Okay, so I will proceed. I assume that you can see my slides. Again, thank you for bearing with us. I will present a kind of key characteristics for policy briefs, and also I will show you some examples of developed and produced policy briefs. Also, at the end, I will present and introduce the recommended template for presenting of policy briefs. I am Mehrnaz Kheirandish, Regional Advisor for Evidence and Data to Policy at WHO Regional Office for Eastern Mediterranean. Okay, so as mentioned by Dr. Arash Ashidian in his presentation, policy briefs are the key tool for policymaking, which we can assume them as a kind of summary brief of the best evidence for making policies. And also, as mentioned again by Dr. Rashidian, policy briefs can be used to address all questions raised during the policymaking processes. I mean, in 4 stages of policymaking processes, starting with priority setting, policy identification, policy formulation, implementation, and monitoring evaluation. For all these stages, we can use policy brief to address the questions raised by policymakers and decision makers. But the main important thing is to have some brief. I mean, when we're talking about policy brief, we need to have some document which is brief. However, I'm sure that you have seen some policy briefs, some documents labeled as policy brief, which are too long, I mean 100 pages, so we cannot call them policy brief. Also, it's important that for development of the policy brief, we use a kind of robust and valid method that to just make sure that the best and latest available evidence are considered for development of the policy brief for identifying the policy options. So in that case, you can just convince your user and the end user of the policy brief, who is policymaker, that this policy brief includes valid and relevant content using the best available evidence. Also, all policy briefs need to include and to have policy options and key messages that address the problem, address the key question that the policy brief is developing for. But just imagine that you observe all these items, but the final product, the final document is presented in a way which is not easy understanding, which is not as appropriate as much to be easy reading, to be understanding by policymakers. So in that case, you will lose your reader. You will reduce the use of the policy brief, and you will lose the use of the policy brief developed by you. So in that case, it's very important, while you are addressing all these key characteristics, also to present your policy brief in an appropriate template and a structure. So as you have seen so far, there are so many policy briefs, as I mentioned, which are too long, some of them do not even include any policy options, any key messages. So now I will just bring some of those examples to your attention. So look at this table. These are some of the topics for some developed policy briefs. As you can see, some topics are very short, very focused and understandable, but some topics, as you can see at the end, they are so long, so we cannot use these long topics for as a title for policy briefs. Also, you can see, for example, the title, which is ICN policy brief, which is not clear that this policy brief developed for what issue and for what problem. So these are the policy briefs developed. As you can see, even the topic that you use for policy brief is very important to have use from policymakers and end users. Now let's go to some of the content of some of the developed and published policy briefs. This is one of the policy briefs, which you can see the topic is on improving access to artemisinin-based combination therapies for malaria in Burkina Faso. So the title of this, the topic of this policy brief is very clear, it's very focused, short, and you can understand easily that what is this content, the content of this policy brief about. And here you can see that it mentioned that you can find the policy options in table 1, and you can find the implementation considerations in table 2. Let's go to tables. This is the first table included in this policy brief. As you can see, there are 3 policy options identified for this problem, and you can find the description and the characteristics and details for each policy option here. Their description, advantages, disadvantages, cost, and acceptability. And in another table, again, you can find the 3 policy options, which their implementation considerations, the obstacles to implement those policies, as well as the facilitators, you can find them here. So this is one of the best way to develop and to present the policy briefs. But now let's see another example. As you can see, the topic of this policy brief is improving patient safety for better quality of care. So this is a very general and broad topic. You cannot understand exactly what is the main issue that this policy is developing for, is developed for, what is the specific item that it's going to address. And even when you go to the problem, which is adverse events in national health care, again, it's not clear that what is this policy brief talking about. And then when you go to the policy option, there are 3 policy options included in this policy brief. I want to ask you to just look at the first one of these policy options, which is nurse staffing models for health facilities. As you can see, the policy option should be clear, should be kind of key, should include a key message, should be actionable. But here, when you talk about different models for nurse staffing, it's not something that you can, it's not a kind of policy option. You don't have any message here. And the reader of your policy brief cannot understand that what is the best model, what are the options of different models that can be used to address the problem. So just within this few examples, I wanted to again to talk about the different ways of policy briefs which are developed, and we can see that some of them, they are not using this standardized model, and they are not including all key elements for the policy brief which is needed for the end user. So based on that, in WHO EMRO, we developed a kind of template for presenting of the policy brief. And we believe that policy brief should focus on a single topic, on a single problem. It should be from 2 to 8 pages. And in other words, it should be from 1,000 to 3,000 words maximum. Let's go to the template. As you can see, there are 9 key elements to be included in the policy brief. Then in the next few slides, I will go in details of each of them one by one. So let's start with title. So all policy briefs should have title, of course, but the title should be short and focused on the topic. Avoid using any abbreviation, but this is not just for the topic of the policy briefs. In using abbreviation in the whole text of the policy brief, I mean, is not suggested, is not recommended, unless it's a very, very famous abbreviation, not among just researchers, also among policymakers and policy developers. Also, if you need to have a long, if you cannot, make short the title, you can use subtitle, but the subtitle should be in a way to explain the title better, to clarify the title. Otherwise, avoid using subtitles. And it's very important to select the topic which is catchy, that in a way that you can grab the attention of the user of your policy brief, or the reader of your policy brief. I mean, you can use, for example, question marks, unusual phrasing in a very quickly communicating way. That these are the things that are recommended for selecting of title for policy briefs. After title, we will have justification. You know that for the research studies, for the usual research studies, after title I mean, not thinking of abstract, we have background and introduction. So here in the policy brief, we refer to introduction as justification for the policy brief. Justification, which will include the brief description of the purpose and the aim of development of this policy brief. You should answer to two main questions. What is the problem exactly that you want to address by development of this policy brief? And why this problem is important? So this question should be addressed in justification. And also here is very important to clearly mention that what are the domains and the scope that you are not covering and answering and addressing by this policy brief. Just imagine that you are developing policy brief for the policy options to enhance use of guidelines by private sector. In that case, in your text, in the justification, you should clearly mention that this policy brief is not going to address challenges in public sector. So you should, these are the main items that you should include and should be included in the justification. After justification, we have key policy options and key messages. Here, just in a few bullet points, you should present the summary of the main messages. If you have a few number of policy options, you should bring them here. Just list the policy options of the policy briefs in few bullet points. And also, here is very important. If there is something, if there is an important item that you want decision makers to not miss them, I mean, if there is something that you want to bring their attention to that item, you can include here in the key messages as a key message. So as I mentioned, it's better to use bullet points, clear language, actionable message. After that, we will have description of the policy options. So after using the robust method, you will come up with a few policy options to address the main question and address the problem. Here, you need to put these policy options with a few characteristics and description for each. There are different ways. You can write them as different sections in written, but we recommend you to use the table, concise table, but informative as much as you can. Here for each policy option that you can find, for example, you have 3-4 policy options, that is not recommended to have more than 5, maximum 5 policy options. So when you have here your policy options, you put your description, the advantages and disadvantages for each policy option, which will include the effectiveness and the cost effectiveness of the policy option with evidence. You should also refer to the evidence that you use for this to find and identify these advantages and disadvantages. We will have the cost and feasibility of the implementation, the equity considerations, gender, socioeconomic, geographical, and ethnicity. And also you will include a stakeholders' responsibilities. What is the role and responsibility of the key stakeholders and actors for implementation of these policy options? Okay, after putting these policy options within the characteristics, we will go to method. You know that in usual and in common research studies, after introduction we have method, but here we will start policy briefs with main messages, with key messages, with policy options to grab the attention of the reader, of the policymakers. And after talking about them, we will study present the method for development of the policy brief. This method part should be very concise, focusing on the main methodology used for development of the policy brief. So you should just focus on the main methods. For example, if you did any systematic review, cost analysis, or you had any kind of consultation with experts, here you should include them here. I mean, this method should be written in a way just to convince the user and the reader that you have paid attention, and you use a robust and valid method to search for all best available evidence. So in that case, you will convince the reader that you didn't miss any important evidence. But if you want to explain more about the methods, the steps that you use, you can bring them all at the end as an annex, but you shouldn't include them in the body, on the main body of the policy brief. After having methods, we have further important consideration, which means, okay, so if there is something that you didn't include in the table, you couldn't include as the key messages. For example, you have some suggestions regarding the monitoring and evaluation of the policy options that you are presenting in the policy brief. Or for example, you want to say that for a specific option, for a specific policy, there is a lack of evidence. Or for example, there is an issue that you are expecting emerging evidence, and you want to say that we need to do some update, regular update. So in that cases, these kind of considerations, you can put them here after method. And finally, we will have acknowledgements, that in the acknowledgement, it's important to include whoever participated and involved in development of the policy. If you consulted someone, if you have if you interviewed with someone, so you should put all those people and acknowledge all those involved experts and people in the acknowledgement part. The conflict of interest is the same. I mean, you should put and indicate all those people who involved in development of the policy brief with you. You should refer to the conflict of interest. And there is one general advice in the conflict of interest, which is, you should pay attention to that from the beginning. I mean, from the starting point of development of policy brief, that it's not recommended to include and to involve people who are perceived to positively or negatively be affected by the policy options that you will provide in the policy brief. It's not recommended to involve those people in developmental process of the policy brief, because there is potential conflict of interest. And at the end, you will have sources of evidence, but here, please, again, just include maximum 10 references, which are the key references that you want to just highlight them. Highlight those references here. Do not go to all the references you use. And if you want to mention all references used for this policy brief, you can again put them at the end as annex. Thank you for your attention. I want to also just mention that we had 3 workshops, which all of them just were held by WHO EMRO in 2021 and 2022 this year on development of the policy brief. One of them is about the general principles for development of the policy briefs, and 2 others are the kind of advanced workshop for development of policy briefs for researchers and policymakers. This is the link that you can use through this link, which is the link for evidence and data to policy webpage. Through this link, you can access the materials, PowerPoints, and even the recordings of these held workshops if you're interested in. Thank you so much. So I want to now invite Dr. Arash Rashidian, our Director for Science, Information, and Dissemination, for his second presentation. Thank you, Dr. Arash. The floor is yours.
Yeah, I'm a bit concerned about our audience when we having sort of presentation back to back. I try to be quick on this one, so I share my presentation now. So colleagues who do the recording, you may stop recording and start recording again. So after that. Okay, so this is, I mean, some quick notes and practical notes on this consideration. It refers back to the discussion you heard so far from my colleagues and bring some of them to the fore. you have noted we are not discussing methods behind the development of the recommendations or policy options in a policy brief. So we are not dealing with the methodology behind how to select a policy option. We are focusing on how to format it, how to present it. So those method discussions are, they require much longer time, and they require sort of focus on different aspects depending on the type of policy brief. There are some resources on the website of WHO for that. The Mediterranean region, and I request my colleague Dr. Kheirandish to put the link on the chat box. So some of those resources will be available. You can go and refer to those. Okay. Having said this disclaimer, in terms of the focus of the workshop, I'm going to some of those key considerations. So I'm repeating certain things that were said a few times. First of all, a policy brief should be brief. If a policy brief is not brief, it's not a policy brief. As simple as that. So that looks so very simple thing to say, but we see so many policy briefs that are not meeting the first criteria of being brief. If it's a detailed document, it could be valuable, but it doesn't provide the sort of the purpose required by a policy brief, that is to be simply read by busy policymakers and helping them to reach conclusion or to know the options while spending little time on going through the document. It is written for policymakers, so the language should be relevant to policymakers, so technical language should be avoided. And also to be able to clarify this better, I'm just doing some quick comparison with the different types of documents that are usually addressed. Remember, I also mentioned the policy process are context specific. Remember, I mentioned earlier that policy brief can be addressing different stages of policymaking. It's not just a policymaking process. It's not just about making the decision. It's also about implementing the decision and assessing the impact of the decision. This was covered by Dr. Kheirandish earlier, so I'm not referring to those elements. Okay, so just a quick comparison with policy brief. You've probably seen something similar, but I'll go through it anyhow. So policy briefs are always short. Academic papers could be short or long, depending on the type. Policy brief includes method, but it's brief. The method is just to show the background. So if the details are needed, details should be provided as an annex, not within the policy brief. However, in academic papers, methods are a main element. So they should be detailed enough to show the processes. Policy brief usually includes options. It may require include recommendations, but they are action-oriented. Aiming at the reporting, sort of supporting policymaking process, while in academic papers, we are talking about advancing knowledge, but we know more, for a different area, or what questions remain to be answered. So they related to, policy briefs could be dealing with a larger number of questions given the nature of the policymaking, while academic papers are focused on the key questions that are amenable to the methodology. So a policy brief can include different methods. That doesn't mean that it will be a mixed array of everything, but in a way, it's it's possible to have different sources of evidence, trying to answer different, for example, talking about effectiveness, talking about cost, talking about implementation strategy, and monitoring processes for a policy. So then obviously the data varies, and then obviously in academic papers, we are focused on the methodology behind it and multiple sources. I referred to that earlier. In policy brief, we should spend ample time within that short document that I mentioned on interpretation of the findings and its contextualization, and also giving focus for implementation challenges. That's a major purpose of a policy brief, especially is that good policies are policies that are implemented. If a policy is not implemented, it doesn't help. So for policymaking processes. And because of these differences, the order of content is different, as you heard from my colleague in the previous presentation. Another type of important document is what we call as advocacy briefs or memos. They have a lot of things common with policies. I'm not going to go through each element in the presentation, but in advocacy brief, you are trying to justify a policy or a recommendation that you as the development of the brief thinking that's the best option. So for example, you know that the government, you think the government should do certain things, you develop a brief to justify why that certain thing is needed. Policy brief, however, is a decision-making support tool. It doesn't make the decision for policymakers. Policy brief openly and transparently explains the options. This differentiation between an advocacy brief and policy is absolutely essential. Advocacy briefs could be very helpful. I mean, if there is a, for example, you want to propose a policy or implement a policy related to how to reduce maternal deaths, that's very valuable. However, I mean, you are not going to talk about options for the process. You are, for example, for some reasons, you think that that option is the best option, and that's what you are doing. Policy brief, however, we talk of what options could exist for a policymaker for reducing maternal mortality, what will be the cost of different options, what will be the challenges of different options, and then giving the choice, giving the choice to the decision maker to decide among those. The other important issue is that advocacy brief can be used by lobbyists, can be used by those that have different agenda, etc. So that's another important differentiation that we should bear in mind. And there are certain cases that something is by nature is advocacy brief, but it's been titled as a policy brief. That's the thing that we would recognize if we know what should be included in a policy brief. That's also an important differentiation. Okay, finishing my presentation, policy brief should be short. There is no exception to that. If it's not short, it's not policy brief. It doesn't help. But then obviously it should include all those elements. You heard a lot of elements, so it should be interesting to follow. It should be easy to understand. It should be based on evidence. It should give focus to policy implementation and also address and remain focused on the key policy questions that are the objective of the development of the policy. And that's it, I'll stop here. Okay, so, yep. I think, I see you after here. Does that mean that you are run out of time, or do we have a few minutes? I'm just checking. Mehrnaz, can you confirm whether we have time left or not?
I think we have about 15 minutes, if I'm not mistaken.
Oh, okay, very good. So then let's continue going to the questions. So now I hand over to Ahmed for moderating the discussion.
Thanks very much to all speakers, Dr. Rashidian, Dr. Kheirandish, for this workshop on policy brief development. There were a few questions already asked from Dr. Zuhra. She was asking, I'm curious to know about the work done for countries affected by conflicts. Dr. Arash, you want to take this question?
So please say it again. Sorry, I lost my attention for a second.
Yes. I'm curious to know about the work done for countries affected by conflicts.
Oh, okay. So, I mean, this is an ongoing work. I mean, there have been sort of several documents developed in terms of processes by WHO as a whole, especially during the COVID, but also before that on different aspects of it. I mean, for example, I mean, one good example, my colleagues in the non-communicable disease department, they developed, for example, a policy brief on how to address the needs of people affected by diabetes under conflict situations. So that resulted in the development of a solution package. It was funded by big funders and it was implemented in countries of the region, and then it was extended to other countries. There are also other examples. Many examples exist, I mean, on those processes. In the morning session, we also referred to some examples in this response to COVID situation in the region, so that can be referred to. However, we are also working on developing a formal rapid response system, as I mentioned earlier. So we are hoping that that will become ready next year. So yeah, that's okay.
Thank you very much, Dr. Arash. A question by Dr. Abdulrahim Abu Mustafa. He's asking, with regard to lobbyism, what measures are best to decrease its effect on accuracy of policies? Dr. Mehrnaz, do you want to take this question?
I don't see her. I don't know what happened. She's locked out for some reason.
Yeah, in this case, we will ask you the same. Dr. Abdurrahim Abu Mustafa had two questions. The first one was about the lobbyism. If you want to please read this question.
Yeah, I can. So it's a very important question. One can discuss it. It doesn't mean that you can solve it. I mean, there are different approaches. The first thing is that, I mean, what we call it, clarification and making things transparent is one of the best solutions. That's what I highlighted also in my presentation. So lobbyism exists. It might actually be a good tool anyhow if it's used properly, but often it's not necessarily the best thing for prudent policymaking, especially in areas of health policy, given that many health priorities are not that interesting for different groups. So they are not that touchy, or I mean, they are not politically attractive. So the issue is that the policy brief itself can help. Also, open policy dialogue can help to clarify lobbyism. The main thing, one main major issue, something that is limited in many countries of our region, is that how to manage conflicts of interest. So because of lack of regulation on managing conflicts of interest and declaration of conflicts of interest, some of the resources of people who might be lobbying a policymaker may not acknowledge that, or may do it indirectly in ways that are not clear. So management and declaration of conflicts of interest is a very good tool that should be done. We've discussed that in the policymaking processes. It's part of the resolution of 2019 by the ministers of health, and we're also working on developing further tools that helps policymakers to apply these processes in practice.
Thanks very much, Dr. Arash. A second question from Dr. Abdurrahim Abu Mustafa is asking, during daily work, is it important to develop a daily feedback assessment tool to help in policy review?
By the way, Dr. Kheirandish is back in the course, so if you wanted to address some questions to her, she's in.
Yes.
So just, I mean, very quickly, maybe I just say a few words. I mean, it's good to be, I mean, talking about being online, being daily, being rapid, responding every question is interesting. However, that's not the way policymakers work. One of the major processes is that you need to have a prioritization process that will help to decide on the best solution and the priority question that should be answered. So daily briefing is important for the technical teams that are for supporting policymaking. Not necessarily every brief should be handed over to a policymaker. Sometimes that would actually become noise. In certain situations, it can be helpful. Like if you listen to the presentation we had earlier in the morning, you remember I said the first few months of the pandemic, we had scientific brief every single meeting of IMST. Because at that time, the questions were so many that it was important, even if knowing the answer to a question one day earlier was important. So that made sense to do that. Later on, that doesn't make sense. You really need to consolidate the knowledge and then get to a position that you can make a recommendation or make the policy option, etc. So those briefings would be very much context-dependent, nature of the question and nature of the role that the individuals have in policymaking processes.
Thanks very much. Dr. Mehrnaz, did you want to add to the answers provided by Dr. Rashidian?
No, thank you.
Thank you very much. There was a question by Dr. Zohra Mohammadi to have the link of the training workshops, and I think it's already in the chat box. Dr. Mehrnaz has put it for the panelists, and the panelists were kind enough to put it in the chat box. So I think it's there already. So ladies and gentlemen, any further questions? Dr. Ghada Bawazir is saying she cannot see it yet. Or Dr. Ghada, we can't make you upset at all. So,
Dr. Kheirandish, if you can put the link, when you put it, select
the issue,
all panelists.
I cannot. The only option for me is a host and panelists. There is no option for me to select everyone. So I just ask, dear host to put in the chat box. We cannot hear you, Dr. Arash. There's noise.
yeah, so basically what will happen is we can, Dr. Mehrnaz, put the web link to Dr. Lubna in an email, and I'm sure this would reach Dr. Ghada Bawazir and everybody else on the call. We have more than 170 participants in this evening, which might be midday and it might be morning in other parts of the world. So at this end, it's 5 to 8. So we have 5 more minutes for any more questions.
Dr. Mandil, I just want to mention again that I put the link on the chat box for host and panelists. It would be great if colleagues here just to copy and paste it on chat box for everyone, because it's asking again in the chat box. I'm seeing that here. Oh, thank you, Dr. Arash.
Now, Dr. Arash, okay, yeah, see, the director can address everyone, but not everyone can address everyone. So it really makes a difference. Now Dr. Ghada is happy, and she said, got it. And Dr. Yasser Amir well received. Dr. Zuhra Muhammadi is also happy. So it's nice to actually end the session when people are happy.
Dr. Mandil, with your permission, I just want to mention that you will find the material that I mentioned, PowerPoints and recordings for our previous workshops, under the technical products in the webpage, and also within the training packages for evidence-informed policy making. But I want to also mention that some of our recent workshops that we held in the recent few months, they will be updated and included in the on the web page just in maybe in this month or maximum early next month. Thank you.
Excellent. During this session on policy brief development, we listened to Dr. Rashidian introducing policy-making processes and discussing policy briefs as tools for policymaking. This was followed by my presentation on sources of evidence and critical appraisal. And then Dr. Kheirandish shared with you the key messages and policy options in a policy brief and critical elements in a policy brief from a WHO EMRO template viewpoint. The last presentation was by Dr. Rashidian on key considerations in developing a policy brief. And then we had a Q&A session where the questions of participants have been addressed. Any further comments before we close?
Dr. Mandil, I think we have to close, given that we need to give 2-3 minutes break between this session and the following session.
Okay, so I give you the final word, Dr. Rashid.
I want to also say hello to new panel members, Janet and Jeremy. Hello, good afternoon, good morning.
Hello.
Yeah, I mean, so Ahmed is waiting for someone to close this, so I don't want to keep colleagues waiting more than this. So good to see new panelists. Goodbye to everyone on the call, and hopefully you will have 2-3 minutes before the next session. So
thank you for bearing with us. Thank you.